Hello everyone, welcome back to my channel. I am Dr. Soumita Roy, Pediatrician, and today we are going to discuss 5 most important and potential MCQs for your upcoming NEETPG and INSET exam. Okay, so let's begin with the first one. As you can see, students, first one is the image-based question. So let's read out. A 10-day-old newborn presented with icterus, hepatosplenomegaly, and rash depicted in the image below. Identify the most viable diagnosis. So see, students, let's find out the clues now. It's a newborn presented with icterus, hepatosplenomegaly, and rash. Okay, so what is the diagnosis? So this particular rash, students, is blueberry muffin rash. Okay, and this is an indicator of extramedullary hematopoiesis. Clear? Now, where do you find this rash? You find it in conditions like congenital CMV and congenital rubella. Okay, so congenital CMV basically presents to us with, yes, icterus, petechiae or purpura, and hepatosplenomegaly. Okay, so these clues you are already getting in the question. So this will be the answer will be congenital CMV in this case. Read out the other options, students. So it's congenital tuberculosis, congenital CMV, toxoplasmosis, and herpes. So it is definitely option B, congenital CMV. And one more question asked in your AIMS exam, like in around 2018. Okay, it was that CMV is diagnosed by PCR of urine, saliva, and blood. Okay, right? And one more thing, congenital CMV generally presents within first 3 weeks of life. Clear? So next, moving on to the next question, second question of the day. So again, let's read out. A newborn assessed at 1 minute of birth is found to have the following features: heart rate below 100, slow irregular respiration, limp, grimace, blue pale appearance. What is to be done next? So basically, indirectly, you have been asked the Apgar score, right? So students, lots of time direct question have been asked from Apgar score. So now they are going to face the question this way. Okay. So what are the parameters? Definitely you don't expect that straightforward parameters will be asked. Still for your information, what are the parameters? So I have made a mnemonic HRT CR, hormone replacement therapy CR. Okay. H for your heart rate, R for respiratory effort, T for tone, C for color, and last R is for response to catheter, rather reflex. Okay, so here you can see heart rate is given below 100, means the score is 1, plus slow irregular respiration. Here you can see the score is 1, is once again 1. Next is your limp. For limp it is 0. Next is your grimace. For grimace it's once again 1, and the last one is your blue pale appearance. So you can see this is once again 0. So basically from this question it is turning out to be 3. Okay, so basically students, an Apgar score of 0 to 3 mandates immediate resuscitation. Okay, so now let's read out the options. It's immediate resuscitation, wait for 5 minutes, no question of waiting, injection with K. What will you do with K now? And perform an ECG immediately. So better the first option, immediate resuscitation. Okay, clear? Now moving on to the third MCQ of the day. So this is basically a direct one. Appearance of surfactant in amniotic fluid occurs at what gestational age? Okay, so surfactant is basically synthesized by type 2 alveolar cells. Okay, and it comprises, as you can see, majority of it is composed of phosphatidylcholine, followed by phosphatidylglycerol, followed by ethanolamine and phosphatidylinositol. And definitely there are some 4 proteins, surfactant proteins, that is SPA, B, C, D, and few neutral lipids. Okay, and this is synthesized at 20, basically this appears in the amniotic fluid at 28 to 32 weeks. Okay, so your option is option C. None. Now moving on to the fourth question of the day. ROP. What is ROP? Retinopathy of prematurity. ROP screening is done in all babies born at. So basically, this is option A, below 32 weeks of gestation. So what is ROP, students? This is a vasoproliferative disease of retina, right? Where you find the white eye, right? Okay. So ROP screening is mandatory in all babies born with birth weight below 1500 grams, okay, and below 32 weeks of gestation, and with birth weight of 1500 grams to 2000 grams with risk factors. Clear? So here the right answer is option A, right? Next, moving on to the last question of the day. This is once again a straightforward question. How much difference in birth weight of twins make a diagnosis of fetal growth discordance? So basically, fetal growth discordance is a complication of twin pregnancy, and this is commoner in monochorionic type. Okay, and the difference of more than 20% makes the diagnosis of fetal growth discordance. So here the answer is definitely D. Clear? So hope students you have enjoyed the MCQs with me, and of course do subscribe my channel if you haven't done yet, so that you do not tend to miss any of the MCQs that will be uploaded subsequently. Okay. Thank you for watching the video. Bye bye.